Good morning, good evening. Thank you for coming to this lecture, this in-service. I'm Brenda Quarles. I'm one of the wound nurses here at Charlotte Grossmont Hospital. I know you're very busy. You're ready to go past your meds and then do your assessment. So we'll make this very fast for you, okay? It's a very quick in-service. Well, one might say, Brenda, why do we need this in-service? Well, we all can remember the patient that had an emergency colostomy. Pretty interesting case. The patient went back to surgery the following morning. Not good. So this in-service serves as a refresher for some and new materials for others, especially our new grads. But overall is to improve patient care outcomes. The purpose and goal. The purpose of the presentation is to increase or refresh the nurse's knowledge about post-operative stoma assessments. This in-service is geared toward the RN and to the CNAs. I included the CNAs because they are a very intricate part of the healthcare team. They are the one who's most of the time draining the pouch itself while the patient here is in the hospital. So they can report their findings if they see anything abnormal or what they perceive as abnormal to the primary nurse or to the charge nurse. Upon completion of this in-service, the nurse would be able to perform a basic post-operative stoma assessment. Describe the normal characteristics of a stoma. This lecture will be based upon demonstration. Of course, I will be using my abdomen here. Nice belly button too. So let's define ostomy as it relates to stoma. So an ostomy is a surgically constructed opening from the bladder of the bowel to the exterior of the body. This means that urine or feces is rerouted to exit the body through the stoma or to the outside of the body and the abdomen. The word means stoma means opening. Although they may have different shapes and sizes, but they have the same function and characteristics. So let's review your stoma assessment. What you should include in your stoma assessment. You should include the stoma mucosa, the stoma structure, and the peristomal skin. So let's go over each one of these, okay? The color of the stoma. A new stoma will be red and moist. There may be swelling. The texture is shiny and tight with fluid. You may see folds and crevices and creases within the stoma itself. A dark red stoma or dark purple stoma is not good. It indicates poor blood flow. And if you see that, do not hesitate to call the doctor at 2 o'clock in the morning and let him know of your findings. Okay? Let's look at the stoma structure. We want to know the size of the stoma. As you can see, stoma have different sizes, okay? We got the little teeny weeny one, we got the long one. Hopefully that we don't find too many of these, okay? But we might find some on certain kind of stoma, okay? To notice the size, we want to know the length, width, and the depth of the stoma, okay? The stoma size may change over the period of time, all right? The size of the stoma will also determine your pouch, how deep or how you're going to cut your pouch to fit over the stoma, okay? See, this stoma right here will be a little bit different how we manage our pouch in this stoma right here. This is narrow opening. It's a little bit wider opening, okay? Also, you want to notice the protrusion. How far does the stoma sticks out from the abdomen itself? A stoma should protrude 2 to 3 centimeters above the skin itself. A stoma may be recessed or it could be flat. A stoma that is flat or even with the skin, flush with the skin, could create problem with pouching. A stoma that is recessed may require a special pouching mechanism. They may have to use a convex pouching system for that. So notice the shape and the size and the protrusion. Also, you want to notice the lumen. The lumen is the opening of the stoma itself. The lumen should be pointing upwards. Can you imagine if a lumen is pointing downward, to upward? What would happen? Not good. Okay? When you examine the lumen, make sure that you examine the lumen and the stoma. Make sure that you examine with the patient in lying and sitting position. Notice the mucosa cutaneous junction. This is the junction between the skin and the stoma itself. You want to look for presence of sutures. What kind of sutures was used? How many do you see? You can also read the chart to find out how many sutures was placed. You want to know if there's any gaps in the stoma and the skin itself. Can you imagine there's any gaps, little holes around the stoma? We can get urine or feces can fall back into little cracks and crevices, and it can create an abscess or an infection, which will not be good. Okay? So next we want to know the peristomal skin itself. We want to look for the skin integrity, free from injury, no abrasions, no skin breakdown. Now, the stoma itself may be pink when you remove the pouch, but it quickly returns back to its normal color. You want to examine the skin around the stoma in good lighting. You want to know for any pustules, any papules. You just in differentiate in the skin around the stoma itself. You want to look and make sure there's no breaks in the skin. Believe it or not, people can get pressure ulcers from stoma pouching itself. So when you finish your assessment, you should document it in the electronic health record, which is known as Cerner. You want to document the stoma mucosa, stoma structure, and the peristomal skin around the stoma itself. Okay? When you document, you shouldn't document as WNL. WNL could mean we never looked. Okay? So in review, a stoma that is shiny and red is good. That's a healthy color. There's not too many blood vessels, but it may bleed occasionally, but it shouldn't bleed too often. A stoma should be moist. A stoma has no pain, so there shouldn't be any swelling. So there shouldn't be any pain around the stoma itself, okay? So, is any questions at all? Great. Remember, a red moist stoma is a good stoma. Thank you all for coming, and we'll see you around the floor. Thank you. Bye-bye now.